welcome. I know everyone is joining us. We are here for Bob Cortez talking about information dissemination through Seminole County. For this meeting, we're asking all of our attendees to keep their mics and cameras off. If you do have any questions, make sure you type them in the chat box. I am Bridget Lake, President of the Oviedo Winter Springs Regional Chamber of Commerce. We are here today with Bob Cortez. How are you doing today, Bob?
Morning, Bridget. Good morning, everyone. I am doing fantastic. Thanks for asking.
Thank you. And we are here today for Bob Cortez, Information Dissemination through Seminole County. I am Bridget Lake, President of the Oviedo Winter Springs Regional Chamber of Commerce. The Oviedo Winter Springs Regional Chamber is a platform for enhancing business and community interests in our region. And most importantly, we are a resource for your business, providing education, advocacy, and connections. Before we start today, I would like to take a moment to thank our doctors, nurses, first responders, and health professionals out there helping others and saving lives. Let's start with our chamber announcements. Our OviedoWinterSprings.org website has our chamber resources COVID-19 tab. If you've missed any of our Zoom meetings, check them out along with our other resources. We have our Facebook OWSRCC discussion group where our members get to chat and stay up to date. And then we have our upcoming events. Tomorrow at 9 a.m., our Zoom Cafe. Then we have Wednesday, May 13th at 12 p.m., the Oviedo Business Women's Network. We have Thursday, May 14th at 10 a.m., Mental Health, a discussion of how to stay healthy in a COVID world. And then Monday, May 18th at 12 p.m., Virtual Business Alliance. And I want to thank our sponsor for today, UCF, Oviedo Winter Springs Incubator. Since 1999, the UCF Business Incubation Program has been helping startup companies develop into financially stable, high-impact businesses by providing the tools, training, and infrastructure that help facilitate smarter, faster growth. To learn more about the program, please visit incubator.ucf.edu. And now let me introduce Bob Cortez. Bob previously served as the Commissioner, Deputy Mayor, and Mayor for the City of Longwood. Bob was later elected to the Florida House of Representatives. In 2013, the Hispanic Chamber of Commerce of Metro Orlando named Bob Cortez one of Central Florida's 25 most influential Hispanics. He was also a member of NALEO and the South Region Chair for the National Hispanic Caucus of State Legislators. Bob is currently the Senior Administrator for Community Affairs for the Seminole County Sheriff's Office. Bob, thank you for joining us today. Why don't you give us an update?
Absolutely. And good morning, Bridget. I want to thank you and thank the Oviedo Winter Springs Chamber of Commerce, its members, and its board for allowing me to update you guys on something of utmost importance. You know, these are the unprecedented times. We came up a few months ago with a novel coronavirus pandemic that we have never seen before. Nobody has. And many were obviously unprepared for this. The state, the nation, and the world was not prepared for something of this magnitude. And there was no manual of how to really handle something like this. And information became of utmost importance. And I'd like to share with the members is that how many of you out there wake up every morning and get your news from social media, from Facebook, from Twitter, from Instagram, or you get it from your newspaper or your TV and radio media. There's so much information. It's information overload, and everybody's saying something different. Regionalized. You talk about regionalization of the information. What the information is coming out in Orange County is not necessarily what is happening in Seminole County versus Volusia County versus Osceola County. So the way the leaders in government are presenting some of the information to its residents, you hear it on the news, but you not necessarily think it may or may not apply to you. So this is why the dissemination of information is extremely important. And it has to be accurate. It has to be based on facts, not just conjectures. I mean, we gave, for example, the last week you saw a lot of memes popping up about the murder hornet, coming around. So is it something that all of a sudden Florida is going to be bombarded with, killer hornets coming through there? Hardly. It's not the case, but these are the things that are popping out that are very important. And the importance of the communication came to fruition here in Seminole County when at first you saw the president doing daily press conferences on COVID, and then you saw the governor that is still doing daily press conferences with information, and then regionalized the local leaders, Orange and Seminole, are hosting usually their daily or at least 2 times a week press conferences. And what I tell people is, try to at least hear some of these press conferences if you had the chance. The governor's always has his on the Florida channel. President usually reports this every evening. And then Seminole County has theirs every Monday and every Thursday, usually at 2 o'clock. Well, several weeks ago when this all started, Seminole County was doing a great job in trying to get the information out. But one thing that I noticed they were not doing is that the information was not being disseminated in Spanish. And why is that important? You've got 472,000 residents in Seminole County today. About a quarter of the population, about 120-something thousand, are Hispanics. And as we talk about flattening the curve, and I'll show you shortly what I mean by that, the idea of the county, the county emergency management manager, Alan Harris, and our chairman, Jay Zambauer, and even our sheriff, to provide this information so that everybody can understand and possibly adhere to it, was important to give it in a manner that they could understand. You can see the person doing the sign language was doing a phenomenal job in making sure that those that cannot hear can at least understand what it's saying. But at the end of each conference, I noticed that they were not providing this information in Spanish. And we weren't the only ones. Orange County wasn't doing it either. And at one point, the Orlando Sentinel took notice of that and said, guys, you're doing it wrong. You have, 800,000 Hispanics in the Central Florida region, and this information needs to get out. So we talked to the chairman, we talked to the emergency manager, they understood the need. And the first thing they did was update the website, prepareseminole.org, to have a whole Spanish section with information, with data, with charts, with video in Spanish. And the other reason why this was important is we were tracking the positive cases in Seminole County. We noticed something very unique and interesting, that out of all the positive cases, at least 30 to 38% were Hispanic. Out of the 8 deaths that had occurred in Seminole County, 50% or half, 4 of them have been Hispanic. So you see, the information had to be given in a way, in a manner that they would understand. So with my help and the help of those in emergency management, we all got together and the decision was made that the information had to be given, at least a recap of what the emergency manager, Alan Harris, Jay Zambauer, and any of the speakers, including Donna Walsh from the Department of Health, was saying had to be given in Spanish. And it continues today. You have several speakers after each press conference. The county right now is having somebody doing these in Spanish, which is important. And why is the importance of what were we saying? So you saw that at the beginning of this, back in March and beginning of April, Orange County and Osceola County and other counties went with a total stay-at-home type of curfew mandate. Seminole County did not do that. Seminole County did an executive order that was more of a social distancing order. It was not, you can't go out and lock yourself in homes and shut down all the businesses. It was more adhere to this social distancing measure 30% of the occupancy of the establishments and everything else, and 6 feet away, no more than 10 congregating. All those things were important to start doing. And Seminole County never really shut down the county like others did. Until this day, even after phase 1 reopening, we still are having our social distancing requirements in order to keep the numbers low. And in my opinion, in the past month, and I'll show you some of the numbers, it has worked. I'm going to share a quick screen right here so that you can see the numbers. So this is coming off the Florida Department of Health website, and you'll see that in Seminole County, there's been 402 positive cases, 89 hospitalizations and 8 deaths, and non-residents is 6. What's unique is that you have the breakdown here, 304 white, 57 black, and 41 other American, non-Hispanic, 251, and 151 Hispanic. This is where that 38% number I was telling you about. Gender, 217 female, 185 male. And then, of course, the median age is 47. Now, this is the flattening curve that I was talking about. April 1st was the highest date we had, 29 cases. And you can see right here on May 2nd, we had no positive cases. 2 on May 3rd, 5 on May 4th, and 4 on May 5th. What's unique about this number and the flattening curve of going down is that as we went from here, not many cases were being tested as they are being tested today. So the testing has tripled, quadrupled, I don't know the exact number, but it's gone tremendously high in testing, and the positives are coming back extremely low, which is lowering that percentage at positive. At one point, Seminole County was at 9. I think we're probably down to 3 or 2%. It continues to go down really low. And the uniqueness is that the county is having testing sites all over the place. Inclusive, they're going to be hosting some testing sites in some Hispanic areas or Hispanic churches because of that high number of Hispanics. So they've done a great job in bringing out these testing sites. And then Advent Health and Orlando Health have also done a phenomenal job in continuing the testing on the private side. And just to do a quick comparison, the next nearest county here is Volusia. And in comparison on Volusia had 514 cases positive, 91 hospitalizations, and look at the amount of deaths, 27 deaths. Median age is 53. Look at the ethnicity, it's 407 versus 69 Hispanic. And then, of course, theirs kind of went up, down. They had a few days that they were high, and then yesterday they only had 1 case. And you can see something like this going around statewide. This dashboard is on the Florida Department of Health's website that you can see it. One more thing I wanted to show you that was of importance because we live it here locally. So this is the county by county area, by zip code. And if we went to right now, cases in the Winter Springs area, actually this is Oviedo area, 44 positive cases in Oviedo. And this is the whole, most of your members' area. And then Winter Springs, you had 32 cases in Winter Springs. The hot spot, though, is where I live, actually, in Altamont Springs, total of 64 cases. So these numbers show in our region, in our county, where the hot spots are. And most of these, like in my area, the hot spot is actually coming from adult living facilities that we have here that have come up positive. And the county and the Department of Health has done a phenomenal job to try to mitigate those. So in Seminole County, the Sheriff's Office itself has done a phenomenal job in the enforcement part of it. Now I'll explain. Because it was an executive order from the county and an executive order from the governor, the Sheriff's Office and the deputies were tasked with enforcing any of the violations of the executive order. And we were getting calls on either establishments and others that were in violation or possible violation of the order. But what we were doing, and the deputies have been instructed to do, is that we didn't want to be the enforcers of this. We wanted to be more the educators of what they were doing wrong and how we can help them do it right. And if these businesses were open, we wanted to stay open as long as they adhere to the social distancing guidelines. And if it was a business like a bar or a personal care that was opening, they were not supposed to, we had to inform them that they needed to close down. So what we were doing, first we would give them a verbal warning. We'd go out there and give them a verbal warning and actually educate them, give them some pamphlets, some information that said, listen, this is how you can do it. And then the second time, we would go out there and give them a written warning. And the written warning. By the way, these executive orders carried a fine of $500 each time. We were not fining people. And then the third time, you could get a written citation or a fine. The fourth was a report, and some of these establishments, like the bars, or those that fell under the DBPR rules, then got reported to the Department of Business, Professional Regulation, and others. So I think till this day, we really didn't fine anybody. We just pretty much educated everybody along, which is the whole thing that we want to do. We didn't want to be the bad guys enforcing these things because we understand we're all in this thing together. And you saw what happened in Texas this past week with the salon owner who actually, the judge, gave her 7 days in jail for her refusing not to close her establishment. Here's somebody that's trying to make a living, and a judge orders her 7 days in jail. And the governor came to her rescue and said, no, we're not going to put her in jail. And then the lieutenant governor says, I'll even pay the fine, So these are the things that our governor is definitely looking to do, is that we can safely open, that we can reduce the amount of incidents of infection, and that the businesses can come back and start doing what they're doing. And businesses are hurting. I mean, we understand that it's really hard. So they started May 4th with the phase 1 reopening, 25% of restaurants, capacity, and then outdoor seating also that they can use. All other establishments having a 50% capacity, including the places of assembly like churches and stuff. They still have to maintain the 6 feet separation. And then the other thing that was required is that if you're inside a building, you do require both employees and patrons to have face masks. And again, this is a way of just protecting yourself. I mean, I personally, if I go out, I go anywhere I go, I'll use a face mask if I'm going to come in contact. And that's what everybody should be doing, because in order to get ahead of this and everybody to be successful when they open their business, things are going to have to be done differently. You're sanitizing, you're washing your hands, your face mask. All that has to continue. We cannot let our guard down because of that. And then phase 2, we're hearing that phase 2 is in the works right now. Currently, no bars, no Airbnbs, no personal care like hair salons and barbershop. You can see my hair. I need a haircut myself. Hospitals have started allowing a one person with patients, something that they weren't doing before. So if you landed in the hospital, your family member, wife or spouse or mother or father cannot be there with you. Now the hospitals have changed their procedures, and they're actually allowing it. That started this week. Gyms and fitness centers are still remain closed, and adult living facilities, nursing homes are not allowing visits for now. But the governor's working on allowing personal care and others to reopen based on data they're receiving from the CDC, based on data that's coming in daily from the phase 1 reopening. As we see the restaurants and people trying to go back to that, it's coming to fruition. I want to also talk about quickly about we had and we saw recently in a survey that was put out by University of West Florida. And I can share this with the membership, or with registers you can share with the membership. They did a survey this past week that was really interesting, and they surveyed a lot of people, and they said basically about 90%, this is a big number, 90% of Floridians reporting reduced spending across many different industry sectors, including restaurant, entertainment, retail, and shopping, gas, everything that was used for them. I mean, food obviously was up because we were staying at home and eating everything we could, right? But it's interesting to see that everybody staying at home was not booking flights, was not going on a cruise, was not going out to movies or restaurants because they couldn't. 61% of Floridians canceled or postponed plans to travel, whether it's going on vacation for the summer with their kids, going on cruises, going on Disney World, all these things. 61% had traveled. Then an additional 24% had already experienced some loss of wages due to COVID-19, and 18% expect income loss to be imminent. This is a good survey, and I'll share the survey with you guys on the business front. University of West Florida did a great job in putting this together, just to kind of give us an outlook, because that's the thing that we're trying to give everybody the information on a daily basis, but we don't have a crystal ball. We don't know what the future is going to bring, and sometimes the doom and gloom is not helpful. I'm actually more of the glass half full. I'd rather see the good things, that the economy is going to rebound and the businesses are going to rebound and move forward. And finally, the sheriff was heavily involved with the governor and the state in some of these reopening work groups, and some of the recommendations that they asked for, we provided, and we provided the things that we were doing in Seminole County. We were actually doing 30% of the capacity to allow. The governor did 25%. We recommended that. We also talked to them about our courthouse and our jails. Nobody's talked about that. Once you reopen, you're going to see cases of people, getting arrested for other things. And I can tell you right now, our inmate count has almost dropped almost in half. We used to have around the 900,000 inmate count in our jail. As of yesterday or today, we have 598. Our jail count has gone down, which is a good thing. I think we haven't had any cases in our jail and proper social distancing, but the more people you have in the jail, it's harder to control. Other jails have had some cases, ours has not. The court systems are going to be handled a lot through virtual. And I think after all this is done, you might see that even be something of the new norm. And so we recommended to the governor also to look at some of these things in the court system, in the jail system, and everything else. So our recommendations were heard as part of what the sheriff, as part of being in the work group, could do. And finally, I'll open up for questions here shortly. At this point, we believe that we're getting to a point that all businesses should start getting ready to reopen, as long as they can adhere to the guidelines, the CDC, the guidelines that we set forward, the social distancing guidelines. I think if most businesses could come up with a good plan that they can protect the public and themselves and their employees, I think they're eventually going to be allowed to open and continue doing business. Is it still going to hurt? I'm sure people, until they feel absolutely sure that it's safe to go out, you might not see the stores filling up. But I think it's a slow process that we're going to move forward. And the Seminole County Sheriff's Office and Sheriff Dennis Lima is ready and willing to help in any which way we can. We're all watching, and if there's going to be any increase in suicides or mental health insurance. I know you have a mental health thing coming up next week. We've been monitoring our overdose count, and it's ironic that our deaths are down 16% for the same period last year. Our overdoses are slightly up, but I mean, this is it's one of those things that there's no predictor to that. We're also monitoring any domestic violence cases or any burglaries and everything else. Thankfully, crime is down in Seminole County. We've seen some car break-ins and some stuff on bike trails, on the walking trails that people park their cars. Just be aware of where you park the car. Don't leave any valuables in the car, purses, IDs, and phones. And, don't become a victim. And if you do, feel free to call the Seminole County Sheriff's Office, and we'll be there to help. And with that, I'll open it up for questions.
Thank you so much, Bob. And we do have some questions coming in, so I'm going to be reading them to you. And first we have, has there been any instances of people becoming disgruntled because a business or other facility requires masks before being allowed to enter?
Well, no, we have not seen that. I mean, people they actually get mad if they see somebody without a mask. We've seen that calls come into our call center to complain and say, hey, I've got a person here that's not adhering to the emergency order or the guidelines that you've set forward. And again, when we go out, I'll compare this to what is current statute. Current statute prohibits smoking in an establishment. If you're in a restaurant or a place, indoor place, the statute does not allow smoking. So who polices that? If somebody lights up a cigarette in the establishment, who polices that? Do they call the sheriff's office immediately or local law enforcement? No, it is incumbent of the manager or the person in charge of the establishment to say, hey, listen, you need to put that out because I can get fined for that. This is the same thing that we're telling everybody. If you're in an establishment and somebody's not adhering, politely tell them, listen, this is for your safety and mine, and I can get fined if you don't do this. And if they still don't adhere, they can always call the sheriff's office and we can come out and educate.
Thank you. And our next question, we are already seeing restaurants with full parking lots, which though I want them to succeed, would hardly be complying with the requirements for social distancing and separation.
Well, like I said, this just started last week, and it's a learning experience for all of us. We have a system in the sheriff's office that we do get a complaint. It's assigned a special code because we track it that way. It's a special unit code, and we know whether that complaint was from a executive order, whether it's from the governor or the local Seminole County complaint. We know what it is. And like I said, we go out there when we get a call and we just educate the establishment. Usually it's the warning, the verbal warning is more of an educational type of thing. If we see a violation, we say, listen, you're going to have to limit that as per the statute. Now, if they are having patrons outside, that is allowed as long as they have the 6 feet separation. It's inside the building that they cannot exceed the 25% threshold, and they still have to maintain 6 feet.
I have to say that I saw a funny video on social media the other day of a server outside throwing glasses and condiments at a table, showing the distancing aspect of it. It was humorous, but it is showing the phase 1 of opening and how we do need to be cautious of, just people's space. But it was some humor to it. We have our next questions. Speak again about personal service businesses such as salons, barbershops, etc. Is there a date for these businesses to open within the guidelines? Sorry if I missed that. And I know that phase 2 hasn't quite been talked about. I'm adding this as my own little part. Do we know, I want to ask that question. Do we know what is part of phase 2? Are salons, barbershops part of phase 2? When is that happening?
Well, last Saturday, the governor, our Chairman Zenbauer and Mayor Demings and others sent a letter last week on Saturday to the governor, petitioning to ask them to allow for personal services to open. They said, listen, I think we can handle it locally. We would like for you to give us the go-ahead to allow them to open. Now, here's an interesting tidbit. In all this, in all the executive orders, the personal care establishments were never ordered to close. The only things that were ordered to close per the governor's mandate were bars, gyms and fitness centers, and Airbnb type of facilities. Hotels were not ordered to close, and personal care, although they were not ordered to close, the governor did mention in all his press releases that they should not be opening because they cannot adhere to social distancing guidelines. Seminole County went a step further. Although we did not prohibit them, we said if you want to open and sell gift cards for future use, you can do that, or sell shampoo or hair coloring or any other stuff that you can sell in the salon. You can do that. It's just because in the hair, you're going to cut somebody's hair, do somebody's fingers, or massages. You actually cannot be within 6 feet of that person. and adhere to the social distancing guidelines. What I am understanding, and it's happening, the governor came down to Orlando Saturday. He met with others in the personal care industry. He met with the mayor. He met with others, and they're discussing with the CDC of a proper procedure to allow these to happen and what that may look like. I mean, you might have to see that it might be hair by appointment only. You know, you can't have 4 or 5 people in the salon waiting to get their haircut. You can only do it by appointment only. And then you might have to, use sanitation, proper sanitation of the equipment, scissors and everything else, which they should be doing anyway. And then the person providing the service is going to have to probably wear a lot of protective equipment, including gloves and others. So I think you may see that coming. They have not established a date, but we get messages from the governor's office on a daily basis. Seminole County will allow that as soon as the governor gives us the guidelines for them to open and how to do it that are coming from the CDC. And we want to encourage them to, once they get that, to do that. That's going to be potentially in the phase 2. We haven't heard exactly what's coming in phase 2. We may hear that the gyms and fitnesses may be allowed to open as long as, again, they can do the social distancing, they can sanitize the equipment, they have people, extra staff on board to be able to protect the general public.
Yeah, and I think everyone is waiting for haircuts to be open. I think that's what everyone is waiting for. They're just, so I understand, Mitch. We get it. We're all waiting for that moment too. So hopefully soon is what
Right.
you're getting at. Hopefully soon.
Right. And prepareseminole.org will have an update, whether it's on the Facebook or on the website, when that happens.
And we share that all the time. Prepare Seminole is on our COVID-19 at OviedoWinterSprings.org. Also, Prepare Seminole, as you were saying, you guys twice a week have a live Facebook. Alan Harris, who is the emergency county manager, twice a week, which is it? Tell me those dates and times again.
Mondays and Thursdays at 2 p.m.
Thank you so much. If you want to key into those, because I know he has great information. Next question. Have there been any reported cases of COVID at John E. Polk Correctional, and how are they implementing social distancing there?
We have not had any cases. I've checked as the last night we get a daily report. We have not had any cases in our jail, thankfully. And the social distancing has actually worked out because our case count, our inmate count has actually gone down. Like I said, we normally house about 1,100 inmates on a daily basis in our jail. As of last night, 598 inmates. So we have pods and separate places where we can keep them. And now that we have less, is actually a lot easier. And it's good to mention that this past week was correctional officer week, and we want to make sure we recognize them for the job that they're doing. That they're keeping themselves from being exposed, but also keeping the inmate population safe and secure to make sure that they don't get sick. And we had to stop visits and anything else to the jail in order to keep our inmates from being exposed to the outside elements also.
Thank you. And our next question, any reports of pop-up hair salons or stylists going to someone's home that should comply and keep some of these folks from making money? And actually we have our Mitch, who is the owner of a hair salon, says, Gary, I can tell you that it is not legal in normal times due to our licensing. So whether people are doing this or not, it's definitely not legal, is what Mitch is saying. So, Bob, did you want to add anything to that comment?
No, Mitch is correct. On the DBPR, they are prohibited from doing any of the work at home. I mean, we don't have any exact figures. We have heard of cases like that. Again, if we've gone out, it has been to educate, and if any reporting has been done, it's been done directly to DVPR. We did have early on, when the executive order came out, we did have a salon, I think, or a barbershop in Altamont that we had to go multiple times, and they were, although they were not cited, they were given more than one warning because of this. But again, I got to put myself in Mitch's shoes. Is that, you have a business that has been completely shut down, and people, Harris continues to grow. I mean, what are you going to do? And hopefully we can get that resolved soon, where the personal care services will allow it to be reopened soon.
Next comment was just pretty sure the governor, mayor, et cetera, are still getting hairstyled by someone, right? I was just commenting that luckily my hairstyle can keep growing and I don't really have, anything to worry about. So I think guys are really the ones that have more to worry about in this situation.
Yeah. I can tell you the governor has not had a haircut since this started. He actually said in his last press conference, he said, look at my hair. I haven't had anything done. And, Brian Byer, who's our public information officer, has had his wife cut his hair twice, and she's not a stylist. It's just, myself, look at me, I'm down to gel. I have to use it and use some gel and kind of do the best that we can. But hopefully this will come to an end soon and we can get back to somewhat normal.
Well, I want to make some comments here at the end. You were showing the Florida Department of Health screen earlier. Some great information on there, some statistics when it comes to COVID. Make sure that you check that information out. Also, the prepareseminole.org is also on the OviedoWinterSprings.org. We share that, the Seminole County information. We share the U.S. Chamber information, the Florida Chamber information, also Orlando Economic Partnership, some IRS tax relief information. I know that we've talked a lot about the PPP. I know that some people don't necessarily have access to the PPP. We've actually, at the Chamber, because chambers have not been eligible, we have been looking into the retaining employee relief credit. So, there's other ways to look into stuff. If you have any questions about that, make sure you contact us, or the IRS tax relief is on our website. Again, Bob, is there any last things? I don't have any other questions coming in, but you just put together a terrific presentation today. I cannot thank you enough, and everything that the Sheriff's Office has done. I know you've just been working so many hours and really keeping everything safe and together. So thank you so much for today.
And it's my pleasure. My final comments is this: Seminole County, again, ahead of everything from the school board to Seminole State College to our law enforcement to our local leaders. Our 7 cities have done a phenomenal job in containing this. And we compare our county with, let's say, Osceola County. Osceola County is less population than ours, about 375 versus our 472. Yet they have a lot more higher count than we have. They have 515 cases versus our 402. And, Volusia County, similar in population. Again, they have a higher count than we are. And, again, Osceola did impose a curfew. We did not. We did social distancing, and it worked. It shows that our case count is low. We are not out of the woods. I caution everybody, continue to exercise common sense, exercise social distancing, and cleaning, wash your hands like the CDC says, and everything else, and don't expose yourself to this. We're going to get through this. Like I said, we will persevere, and hopefully we'll look back at this and say, gosh, we went through some tough times and we made it through. And I wish everybody the best, and any questions, concerns, feel free to reach out to Bridget or us here at Seminole County Sheriff's Office. God bless everyone. Thank you.
Thank you. Stay safe, stay healthy. Have a great afternoon.